Hello, this is me again. My name is Joanne, and for now, I will be discussing to you a different topic. Apart from the Michaelis David column, I'm also tasked to create a presentation, and I will be presenting to you my next topic, which is CDH.
Congenital diaphragmatic hernia, or CDH, is a birth defect where there is an abnormal opening in the diaphragm. The muscle that separates the chest cavity from abdominal cavity, allowing abdominal organs to move into the chest. This herniation affects lungs, development, and breathing.
So I will first introduce to you what is CDH. So etiologically, or it came from, the exact cause of CDH is not fully understood or it's unknown, but is believed to result from abnormal development of diaphragm during 8 to 10 weeks of gestation. It may occur as an isolated defect or be associated with genetic syndrome and chromosomal abnormalities, just like the Down syndrome, something like that. So for the incidence, CDH occurs in approximately 1 in every 2,500 to 4,000 live births. It is one of the most common major congenital anomalies. The most common type is the left side Butch-Deleck hernia, as continuing for about 85% of cases. Later on, I will discuss to you what are the types of hernia, including the Butch-Deleck hernia.
The type of hernia actually depends on the location of the cavity. Now in this case, there are 4 cavities, but the most common was 3. We have Butch-Deleck hernia, the most common, Morgani hernia, rare, and a very rare hiatal hernia.
So what are the predisposing factors, or what are the factors that affect or could be risk factors for CDH? So it actually includes family history of CDH, genetic condition like trisomy 18 and 21, the Down syndrome, and certain environmental exposure during pregnancy. Most cases are sporadic without a clear identifiable cause. So let's say, for example, a pregnant woman was exposed to radiation. She accidentally did an x-ray, so that could cause as well.
So this diagram that I'm showing to you is the actual pathophysiology of one type of hernia, which is the presence of Butch-Deleck diaphragmatic hernia. So as I mentioned in the earlier part, this would actually occur when there is a defect in the diaphragm. Effective physiology would include chest, diaphragm, and abdomen. So early in the fetal development, it was expected to go closed, but in this case, it remains open, allowing abdominal organs such as small intestine, stomach, and liver urinate up to the lungs. So it is expected to compress the lungs, so that would actually have our first problems of the pathophysiology, which is the pulmonary hypoplasia. Now, left ventricle hypoplasia and surfactant deficiency would recur, leading to respiratory failure. Promotes an increase of partial pressure of carbon dioxide and decrease of oxygen. Causes constriction of pulmonary vessels that increase pulmonary arterial pressure. So abnormal circulation pattern. As a result, the newborn often has severe breathing difficulties and persistent pulmonary hypertension. The extent of lung damage depends on the size and the location of the diaphragmatic defects.
The malpositioning of the pediatric's intestine would actually cause respiratory distress, because of course it would promote lung compression. So as part of our nursing responsibility, of course, we are to make sure that the patient can breathe adequately. So we're going to monitor the oxygenation. We also need to monitor the pediatrics ventilation. We're also tasked to reduce the lung compression and also provide pre-operative care for the patient. And also, of course, since it is expected that there will be like an operation that needs to be done, then we're going to maintain it for the patient to be free from infection.